Hello, my name is Dr. Durairaj. I'm a facial plastic and head and neck surgeon from Los Angeles, California, and I'm going to talk to you today about artificial intelligence and the use of it in counseling our preoperative and postoperative patients in surgery. I was fortunate to write a very interesting paper with my colleagues, the title of which is AI versus Human Surgeon. ChatGPT takes center stage in pre-op and post-op counseling for septo-rhinoplasty patients. And this is an article that explores the potential and effectiveness of ChatGPT, a large language model developed by OpenAI, in providing the pre-op and post-op teaching and counseling for septo-rhinoplasty patients. Since OpenAI was released in November of 2022, this is a free and easy, accessible tool, and there have been so many fast-growing consumer applications. It is now crossing over into the healthcare industry, and it's very interesting to use it as a tool for counseling our surgical patients. We all know that nasal surgery is very complex. The septo-rhinoplasty is an operation that can have extreme success, and much of our success in taking care of these patients depends on patient expectations and patient counseling going into the procedure, as well as understanding of instructions afterwards. And it treats a wide range of functional and cosmetic concerns. And in looking at postoperative changes in quality of life after septo-rhinoplasty surgery, patients report improvements in nasal function, nose appearance, general symptoms, and self-confidence. But one study analyzing satisfaction patterns in rhinoplasty patients found that approximately 23 to 29% of patients were dissatisfied. And that cited expectations which were off. Expecting life to improve was one reason for dissatisfaction. And approximately 13 to 23% of patients cited poor communication by their surgeon as one of the reasons for their dissatisfaction. So setting realistic expectations is critical. This was a cross-sectional study wherein ChatGPT and seasoned rhinoplasty surgeons were compared. They were provided with 6 hypothetical questions that simulated typical patient-physician interactions related to septo-rhinoplasty. The responses were then evaluated by the panel based on empathy, accuracy, completeness, and overall quality. ChatGPT demonstrated impressive performance, often surpassing the physician responses in accuracy, completeness, and overall quality. While physician responses were slightly more empathetic, the difference was not statistically significant. However, it's noteworthy to acknowledge that ChatGPT demonstrated an impressive level of empathy, performing at a similar level to that of a human physician with over 20 years of experience caring for patients. Despite this notable achievement, it's undeniable that empathy is fundamentally a shared experience between the human, physician, and the patient. This not only forms the foundation of medicine, but it also significantly impacts patient satisfaction. So as we look forward to innovation with artificial intelligence, we must understand the special role of human connection. The face-to-face consult can never be replaced. The ability of a physician to incorporate subtle elements like humor, physical touch, the skill to read a patient's face for emotion or fear, or even the need for reassurance, these are some of the things that a large language model cannot do, at least not yet. So right now, I look at ChatGPT as a complementary tool to enrich communications within the relationship rather than replacing it entirely. The findings of this study are promising, and it's critical to acknowledge a few limitations. And one other limitation is that the evaluators consisted entirely of surgeons with expertise in nasal surgery. Additionally, despite ChatGPT's accuracy, there are instances of fabricated and inaccurate references in its responses in other general literature, not specifically in this one, but the article envisions that with further refinements and regulatory oversight, AI models like ChatGPT could revolutionize patient education and counseling, provide real-time information, and potentially reduce the informational workload on physicians. Physicians are busy creatures, and they don't necessarily have time to sit down and write out very detailed, very empathetic responses. But this is something that our patients can do before coming into a consultation in the comfort of their home. They can ask questions that may be trivial, that may feel irrelevant, that they don't have to feel embarrassed to ask because an artificial intelligence model will answer them. And this is very liberating for a patient to be able to reveal any questions, no matter how small. And for patients to get this information prior to their visit relieves a lot of informational burden on the surgeon so that the consultation can really be honed down to their specific ideas, thoughts, and questions that were unanswered previously. I think ChatGPT is going to make us have so much more meaningful appointments with patients because the bulk of those baseline questions will be taken care of. In conclusion, the potential of AI models like ChatGPT to enhance patient education and counseling while navigating these technological advances is difficult is definitely key to the future. In the evaluation of ChatGPT by 7 rhinoplasty surgeons who are very experienced, we saw demonstration of the remarkable ability of the open language model to deliver accurate, complete, and high-quality responses to a wide breadth of pre- and post-op patient questions. Patients seeking to undergo septal rhinoplasty would really greatly benefit from the integration of a large language model like ChatGPT into the teaching process for counseling and education. And we, as physicians and surgeons, can understand that the responses that are going to be given are very accurate and amazingly on point. So the future is bright. The technological advancements that are coming, if we take them with a balanced perspective, if we be sure to add human judgment, I think these are things that will really innovate and inspire our practices to achieve the next level of patient care with artificial intelligence. That's it for now, guys. Don't forget to find me through my social media handles. It's Beauty by Dr. K, DRKAY. I look forward to you guys sending me your questions about the use of AI in the pre-op and post-operative counseling of our septal rhinoplasty patients. Thank you.